Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today, we're learning about umbilical cord prolapse. So go ahead, subscribe, and let's get started. Umbilical cord prolapse is basically a serious emergency that can happen during childbirth, where the baby's umbilical cord slips down through the cervix before or alongside the baby. When this happens, the cord can get squeezed between the baby and the birth canal, and that squeezing reduces the oxygen supply going to the baby. Since the umbilical cord is the baby's lifeline for oxygen, this situation can become dangerous very quickly and needs immediate medical attention to protect the baby's life. So, umbilical cord prolapse is mainly seen in three forms. In overt prolapse, the umbilical cord actually slips down past the baby and can be seen or felt in the vagina after the membranes rupture, which makes it very obvious and dangerous. In occult prolapse, the cord is hidden and lies alongside the baby's presenting part, so we can't see or feel it directly, but it may still get compressed and cause changes in the baby's heart rate. Then there is cord presentation, where the cord comes down in front of the baby while the membranes are still intact, and if those membranes rupture, it can quickly turn into a full prolapse, so it needs close monitoring. Overt prolapse is the type where the umbilical cord actually slips down after the water breaks, and can be clearly seen or felt inside the vagina or even outside the vulva, so it's usually easy to recognize. Because the membranes have already ruptured, the cord is no longer protected and can get compressed very quickly by the baby's presenting part, which cuts down the baby's oxygen supply, making this a very urgent situation that needs immediate action. Occult prolapse is a bit tricky because the umbilical cord slips down and lies alongside the baby's presenting part, but you can't actually see it or feel it during an examination. Since the cord is hidden, it's usually suspected when there are sudden changes or abnormalities in the baby's heart rate on monitoring, which happen because the cord may be getting compressed between the baby and the uterus. So careful observation is really important in this situation. Cord presentation is a situation where the umbilical cord comes down and lies between the baby's presenting part and the cervix, but the membranes are still intact, so the water hasn't broken yet. At this stage, the cord isn't compressed, but it's a warning sign because if the membranes rupture, the cord can easily slip further down and turn into a true cord prolapse, which is why close monitoring and timely management are very important. When we talk about incidence, umbilical cord prolapse is actually quite rare, happening in only about 0.1 to 0.6% of all deliveries. Even though it's uncommon, it is seen more often when the baby is not in the normal head-down position, which we call malpresentation. So these cases need extra attention during labor to catch the problem early and manage it quickly. Now, looking at the risk factors, umbilical cord prolapse is more likely in women who have had multiple pregnancies, because the uterus and supporting structures may be more relaxed. It can also happen when the membranes rupture early, especially in premature rupture of membranes, as the sudden gush of fluid can pull the cord down. Conditions like polyhydramnios, where there is excess amniotic fluid, increase the risk for the same reason. It is also more common when the baby is not in the normal head-down position, such as in breech presentation or a transverse lie, because the presenting part does not fit snugly into the pelvis, allowing space for the cord to slip through. Other factors that can increase the risk of umbilical cord prolapse include a preterm baby, because smaller babies don't fill the pelvis completely, leaving more space for the cord to slip down. A very long umbilical cord can also move more easily and prolapse. Certain procedures during pregnancy or labor, like artificial rupture of membranes, external cephalic version, where the baby is turned from the outside, or amnioinfusion, can sometimes trigger cord prolapse if not carefully monitored, which is why these situations always need extra caution and close observation. Now, coming to the causes, umbilical cord prolapse often happens when there is a sudden gush of amniotic fluid after the membranes rupture, which can pull the cord downwards. It is more likely if the baby's presenting part is not well engaged in the pelvis, leaving space for the cord to slip through. Malpresentations, like breech or transverse lie, also increase the chances, and having an excessively long umbilical cord makes it easier for the cord to move down ahead of the baby. In terms of what actually happens inside the body, when the umbilical cord gets compressed, the blood flow through the cord is reduced, which means less oxygen and nutrients reach the baby. Because of this reduced oxygen supply, the baby develops hypoxia, and if it continues, it leads to acidosis and signs of fetal distress. And if timely treatment is not given, this lack of oxygen can ultimately result in fetal death, which is why cord prolapse is considered a true obstetric emergency. Clinically, the mother may first notice a strange feeling like something is coming out of the vagina, and in cases of overt prolapse, the umbilical cord may actually be seen at the vulva. From the baby's side, the earliest and most important signs are sudden changes in the heart rate, especially fetal bradycardia, or variable and prolonged decelerations on monitoring. And if the condition is not recognized and managed quickly, fetal heart sounds may eventually become absent, which is a very late and serious finding. To diagnose umbilical cord prolapse, the most important step is a vaginal examination, where the cord may be felt below the baby's presenting part. In some cases, a speculum examination helps to directly see the cord, especially in overt prolapse. Along with this, continuous CTG monitoring is very useful, as it often shows signs of fetal distress, like sudden drops in the baby's heart rate, which supports the diagnosis and signals the need for urgent action. When it comes to management, remember that umbilical cord prolapse is a true obstetric emergency, so everything has to happen quickly. The first step is to call for help immediately and start emergency management without delay. The cord should not be handled too much, as this can cause spasm and worsen blood flow. If it is visible, it should be kept warm and moist, using sterile saline-soaked gauze. Oxygen is given to the mother to improve the baby's oxygen supply. And continuous fetal heart rate monitoring is done throughout, to keep a close watch on the baby's condition while preparing for urgent delivery. To relieve pressure on the umbilical cord, the main idea is to use gravity and simple maneuvers to take the baby's weight off the cord. This can be done by placing the mother in a knee-chest position or in a Trendelenburg position, where the head is lower than the feet, so the baby moves away from the pelvis. In some situations, gentle manual elevation of the presenting part may be done by a healthcare provider to lift the baby off the cord temporarily, all while preparing for immediate delivery. So to wrap up definitive management, in most cases of umbilical cord prolapse, the quickest and safest way to save the baby is an emergency cesarean section, and that's why it is the preferred option. Assisted vaginal delivery is chosen only in special situations where the cervix is already fully dilated. The baby is about to be delivered, and the fetal condition is stable, so the delivery can be completed immediately without wasting precious time. In nursing management, the focus is on close monitoring and quick supportive care, so the nurse continuously monitors the fetal heart rate and regularly checks the mother's vital signs. The cord, if visible, is observed for its color and pulsations to assess blood flow, while making sure the mother is positioned correctly to reduce pressure on the cord, and strict sterility is maintained. Preventing further cord compression is a key role, along with preparing the mother for emergency surgery if needed. And throughout all this, providing calm reassurance and emotional support to the mother is just as important. Thanks for watching. I hope this explanation helped you understand umbilical cord prolapse in a simple and clear way. If you found it useful, don't forget to like the video, share it with your friends or classmates, drop your questions or thoughts in the comments, and subscribe for more easy, exam-oriented nursing and medical topics explained just like this.